Hi there. This video is a demonstration of the pop-ups you might start to see if you record a raised blood pressure. The pop-ups vary a bit according to the context for the patient, but also your role. And in this video, I'm going to show how it would work if I was, say, a GP and record a raised blood pressure. So I'm going to put one in here and press OK. And so we're not trying to do the patient care for you. All we're trying to do is make it a bit easier and flag up where there's potential issues. So you can see here the advice to review hypertension control because the BP I've recorded is above their target, tells me why the target is what it is, and that the patient has existing diagnosis. Now, there may be scenarios where the patient declines a BP and they can't be persuaded to have home BP readings. Maybe it's not indicated because, say, they're acutely unwell. There's an option to review now, and that will launch our BP page from our pathology overview templates. There you can see what medication they're on, you can record outcomes and so on. The option we think that you're most likely wanting to use is probably the arrange home BP. I guess it depends how elevated it is and whether you think more immediate action is needed. If I pick this option, it'll ask whether the patient's got access to a BP monitor at home. If you pick no, what it does next depends a little bit more on how you work as a practice and whether you loan BP machines out or not. For this demo, I'll pick yes, and it's generated a preset message that explains to the patient they've had a raised BP. We want to get 5 days worth of readings. There's some information about why it's important to manage hypertension, and it's attaching a questionnaire. That questionnaire they can use to put the readings in, and then when they come back, our protocols can calculate the average, code it, and work out the next steps. When I've done that, just to show you as well in the journal, it's going to document lots of what I've done, and it's going to add various relevant codes. If they don't respond, it can follow it up with further invites and prompts. And because for this practice, we've opted in to do this, we're going to code the QOF invite codes as well. That's because it's not simply enough for the patient to attend their, say, annual review or have a blood pressure. If they then don't engage with our attempts to get that down, whether that's through doing home readings or then following that up with, say, offering an appointment with a pharmacist to discuss their readings, we're going to code these invites so that if they don't engage, we're not kind of missing out on our QOF targets, but we're reflecting the work that we're doing with these patients. The pop-ups will vary a bit. It's up to you, obviously, how you manage them, but we hope you find them useful and help improve patient care. Thanks.